So this woman was absolutely positively having an exacerbation of panic attacks, depression, anxiety, and she had been treated for about 20 years with Prozac. And the onset of her symptoms it happened about 20 years ago when she was in a motor vehicle accident that severely injured her young daughter, who was in case number 1. So the ongoing stress related to this, as well as an abusive first husband, wasn't helping matters. And then her primary care provider had suggested increasing the dose of her current SSRI or adding additional medication, including Xanax. And the patient was just, no, I just don't want to keep going on the merry-go-round of more. What's root cause? So when her daughter suggested she come and see me, that was a no-brainer for her. There was a strong family history of addiction to alcohol and prescriptive anxiety meds. Actually, it was Valium for her father, so she was afraid of going down that same road. So she was extremely interested in discontinuing her meds, not adding to the SSRIs. So her other concerns were significant fatigue and insomnia. So she's menopausal and she's got these other things as well. And of interest, every year in the summertime, she would abruptly discontinue her SSRI because she thought, well, I'm a teacher, she's a speech pathologist, and I'm not in school anymore, so I'm sure that my depression and anxiety will be better, and it would be fine for 3 weeks, and then she would absolutely tank, really tank, and she would need to get right back on her medications very quickly. Of concern of mine was that despite an abusive situation with her husband, her ex-husband, and a motor vehicle accident that really messed with her emotions, she had not had any current or past counseling, yet she was on Prozac for years. So I'm always concerned about that. So family history, again, her daughter, anxiety, paternal grandfather, no, her father was bipolar, and her sister has breast cancer, or had breast cancer. Her meds were Avista for osteoporosis, multivitamin B complex. She would take D3, 2,000 IUs a day, and, of course, 40 milligrams of the Prozac. She was a great eater. She was limited to rare processed foods, no fast food, so she really tried hard to do her thing with proper clean nutrition. So she was now social history, happily married for 10 years. She was a speech pathologist in the public school system in private practice during the summer. She would have a little bit of alcohol, 1 to 2 classes, 4 to 5 times a week. I personally would keep an eye on that with her because of her history. No tobacco. She didn't exercise, and she didn't have any form of relaxation therapy, although she was interested in yoga. She was now in a safe and loving relationship, and the new stress was designing and building a second home. So you always look at what happened, what was going on, why the exacerbation of this. And one of the things that she brought up was it was a home in a completely different area, so it was going to be a little bit of a stressful thing. So personal history, osteoporosis, depression, anxiety, nothing dramatic about her surgical history. So her labs and the neurotransmitter assessment, again, I did an HPA test, so we're looking at not only the neurotransmitters but the cortisol because of fatigue, also looking at ferritin, CBC, vitamin D, B12, because she takes a complex, B6, and, all of the various things. So of interest, her low vitamin D, CBC and ferritin were normal. Vitamin D was a little suboptimal. It was normal, but I wouldn't say it was great. Her TSH was okay, no problems there. Free T4, low normal, but fine, sort of. Free T3, though, was definitely on the cusp. So she had a low free T3, which I always think of that with depression, always, and also low energy. The metabolic panel was within normal limits, and she also had an elevated fasting B6, not terrible, but a little bit. Now, of interest, this woman's on 40 milligrams of Prozac, but yet look at her serotonin. It's 128.2. Look at the optimal ranges, 200 to 415. What's not working here? So GABA is also low, so it's kind of like maybe she had had her peak like her daughter did, and it was coming down because it was just working too hard to try to help serotonin stay elevated. Her dopamine was low. If you go down the line, she's low almost everywhere. And her norepinephrine-epinephrine ratio, so that's kind of like how things are, why is norepinephrine low, but epinephrine is even lower? So, kind of what's going on with that conversion. And so clearly it's a little high, and I would want to look into that further. So cortisol 1, so that's the AM, she's quite low. Cortisol 2, sort of low. 3 and 4 are okay, but, certainly not robust. And then she does have a DHEAS, adrenal DHEAS, that is consistent with what's happening to her cortisol levels in the morning. So she has what I call adrenal fatigue. So she's tired all the way around. Oh, so these were therapeutic recommendations. So this is when everybody turns off their slide and go, I can't possibly do this. This is like way too much. But just break it up a little bit and see how each thing is impacting what you saw on the slide before. So we need to give her a little bit of serotonin support, not tons and tons and tons because she's already on Prozac, so we would want to be careful about that. She needs GABA support, so a Lentra is the product that you use twice a day. She desperately needed Tranquilin because her panic attacks were coming more and more frequently. So I sent her some of that immediately, even before I had her results back, and said take 1 to 2 right when you feel it coming on, and don't try to deal with it yourself for a little while. I did ask her to take a product for adrenal fatigue called Adaptocin. Take that in the morning. That will help begin to heal the whole process of adrenal fatigue. A sleep supplement called Somni-TR, and then for her elevated norepinephrine-epinephrine ratio, soon I was going to consider Methylmax, which is something that helps the conversion of norepinephrine to epinephrine through the methylation process. And so that's a very good supplement to help in that regard, and we'll be doing that shortly. So she's going to continue her Evista. She can't have hormones, or she probably shouldn't because of the strong family history of breast cancer. Of course, music therapy or meditation during the day, critically important for her to bring herself down and just kind of decomp a little bit. I don't want her taking B-complex right now. I want to see what happens with that, and there are some Bs in the targeted nutritional therapy, the supplements for the neurotransmitters, so that will help. Gentle exercise, begin yoga. That was something she wanted to do, so that was a good reason for her to start that. I give various handouts for different things to help with like adrenal fatigue or whatever. Also, I'm really considering supplementing her with some T3. T3 is absolutely plays a role in mood for a lot of people, especially depression. And so sometimes you can just supplement that part of the thyroid cascade, and depression is reduced or gets a whole lot better. And then if you add all the other stuff to help with the serotonin, everything just works better. I don't want to do that right away. I want to try some other things first. So she needs some C for adrenal health. She definitely needs more D3. And then selenium, zinc for thyroid support. We discussed sleep hygiene for insomnia. And then we tried really hard just to talk about why the exacerbation of the anxiety, what's going on. And through that, we realized that just the whole designing and building and financial stress of a second home was causing a little bit of things to surface. And then I asked her to please not discontinue her Prozac until the first retest. So we have a weaning protocol for SSRIs, and it says basically stay on it, see what happens after the next test, and then, if it's appropriate, begin a slow wean. So the second visit, this is an out-of-town patient, so the second visit was a phone call, and she initially was doing exceptionally well. She was beside herself. She was doing so well. So she was starting to sleep. She loved Tranquilin. It was absolutely cutting the panic attacks down to nothing, and her depression was really stable. There was no worsening of anything. However, underline, however. All of a sudden, depression and anxiety returned, and she said, I'm spiraling down. I don't know what's happening. I'm spiraling down. It's similar to when I would discontinue Prozac in the summer. And so I asked her a little bit more about that, and she said, well, it's like that's never a good sign. I ran out of my Prozac, and rather than getting it refilled, I just decided I could go off of it because I'm now taking the supplements. Okay, well, so I asked her to please retest early. So rather than retest in 6 or 7 weeks, I said, why don't you go ahead and retest now? Let's see if discontinuing the Prozac 3 weeks ago had a play in all of this. Maybe her levels had come down. I asked her to increase her Prolent from 1 a day to 2 a day, so that's hopefully going to increase the serotonin, and that if things did not turn around quite quickly, I wanted her to go back on her Prozac, get stable again, and then we would, begin to sort of go through the process again. So I called her a week later, not sure what I was going to find, and she was way better. So she had started sleeping again. She chose not to resume her Prozac. She was definitely better in the depression, anxiety, and I asked her to please continue the serotonin supplement Prolent twice a day until the next retest. So I felt a little bit better about that. So then from 3/22 of 14 to currently, and she's retested for her second time, and she's due again in June. So you can see for the second test, even off of the Prozac, she was starting to climb up in her serotonin levels. GABA was better, a little bit of improvement with dopamine, but I wouldn't really say that's a result of anything I did, except for maybe a touch of the increase in serotonin. Norepinephrine, epinephrine, getting a little bit better. Glutamate was still not really a process, a little bit low, but nothing that I would jump up and down about yet. And her ratio of norepinephrine to epinephrine was coming way down. So that's good. I like that. That was much better. And she was starting to improve with the adrenal support in her cortisol levels. They were much, much better. Even though her morning DHEA in one indice was lower, overall she was better, and she felt better. So the therapeutic adjustment after the retest would be I was just going to slowly begin to wean her down off of the Prolent, not much, from 2 a day to maybe, 1 a day, 5 days a week, or 2 a day, 5 days a week, and 1 a couple days a week, and then eventually hold at 1 if she felt better. Continue with Lentra. You can read these different things later, but we just added some Contegra, which is a supplement that's used for catecholamine support and also to help with her mild menopausal symptoms. She needed to continue with Aptacin. There were a lot of things that we just did through the course of, increasing, decreasing things based upon her symptoms as well as levels. And also I really asked her to consider counseling for the PTSD of the motor vehicle accident and also the domestic violence. She's doing extremely well. This woman was ecstatic. I saw her about 4 weeks ago, 3 weeks ago maybe. She was happier than she could ever remember. And there was no depression or anxiety. It was stunning how much better she was doing. And she said, this feels like a dream. How wonderful is that? So then she referred her sister. So stay tuned for that one.